today what I want to do is talk to you a little bit about a condition that I think is really important for people to understand. It's called Cauda Equina Syndrome. And so Cauda Equina is, it means the horse's tail. And first what I want to do is sort of focus you on the area of anatomy that we're talking about, and then we'll talk about some of the things that Cauda Equina affects and some of the problems that arise with it. So first off, when we're talking about Cauda Equina Syndrome, really what we're doing is we're focusing on the very low part of the lumbar spine. If you were to draw a band really around kind of your waist and go pretty low on your lumbar spine, that is the area of the spine where the Cauda Equina is. And now why Cauda Equina? Why is it called the horse's tail? Well, let me show you. If you've watched some of the other videos, you know that we have the brain and the spinal cord that comes down, and it runs through various levels of the spine. And for almost the entirety of the spinal cord, all these millions and millions of nerve fibers that act as the information superhighway in your body, they're wrapped together, kind of like a tight rope. And they're bound together, and they supply all this information back and forth, up and down the spinal column. But when you get to this area down at the very bottom of the spine, that tight spinal cord begins to do something very different. And these fibers begin to flay out and they look to a radiologist or to somebody who has looked inside at the human anatomy. It takes on the presentation of a horse's tail. As you look at a horse's tail, there are all those starts dense, and then all those fibers of hair flow out. And that's how Cauda Equina came out. That's how it got named. So if you then think about the levels of the spine, and if you've looked at other videos, you know about the block drawings of the spine, and you know about the levels. But in this level, really what we're talking about is the lumbar spine. And down below the lumbar spine, which I did not mention on other video, is the sacral spine. It's just this very small area at the very, very, very base of the spine. Kind of when you think of your tailbone, okay? That's the area just past and just at the sacral spine. But the lumbar spine, L4, L5, then S1, okay? This is the fourth lumbar level, the fifth lumbar level, and the first sacral level. And L3. Okay. And so what we know in Cauda Equina Syndrome is where there is a disc injury. So you'll remember the drawing of the vertebrae and that disc in between. So if we have L4, L5, this disc here is the L4-5 disc. It's the disc that is between the L4 and the L5 vertebrae. When this disc is injured at L4-5, it can put pressure on the nerve roots of the Cauda Equina. Now, Cauda Equina, when these nerve roots are affected, it can have profound implications, because this area of the spinal column provides a lot of the information, a lot of the nerves and the motor and the sensory for some very important function. Bowel, bladder, sexual function, walking. The one thing that's very much affected is foot drop. The ability to raise and lower your foot like this, to lift your foot up. People who have serious injury to the cauda equina, they can end up with a foot drop where when they walk they can't lift their foot. And if the matter's not dealt with urgently, that foot drop can lead to ultimately total paralysis, including loss of bowel and bladder. And I've had cases like that where clients have gone to their doctor, they've had complaints of back pain, they've had certain complaints of numbness, and it wasn't dealt with in a timely way, and they've ended up paralyzed with loss of bowel and bladder, or partially paralyzed with partial loss of bowel and bladder. These are profound illnesses and profound injuries that have a huge impact on quality of life. So, what are some of the things we look for in cauda equina, or to know whether cauda equina is developing? And here's something that's everyone should know, is that Cauda Equina Syndrome, when it first starts to develop, for the most part, you want to try to get treatment, definitive treatment, which usually means surgical treatment, within 24 to 48 hours of the first onset of symptoms. That gives you your best opportunity for recovery, because once the neurological loss occurs, it's very rare that it comes back. Sometimes it does. But if you experience that loss of bladder, or the loss of bowel, or the inability to walk or lift your foot, usually, unless that surgery occurs to decompress, to take the pressure of that herniated disc off of the nerve by removing the disc, unless that happens very quickly, within that first 24 or 48 hours from the onset of that symptom, typically the person's going to be left with that injury for the rest of their life. So time is of the essence in cauda equina. You got to get in, got to get the nerve decompressed. Now, what are some of the symptoms? There's saddle anesthesia. What does that mean? If you imagine sitting on a horse, and you imagine that part of your body that would be in contact with the horse's saddle, your buttocks, the area called the perianal area, where the anus or the testicles or vagina are, and the inner thighs that go down. That part of your body that would be touching that saddle, if there's any type of numbness in that area, that may be saddle anesthesia. So if you have low back pain, if you've had a recent injury, or you've got a chronic problem, if you know you already have some disc bulge in your low back, and you start to develop symptoms there, go to your doctor immediately. Sometimes people don't realize it, but what they do realize is they've just gone to the bathroom and they go to wipe themselves, and they notice that the sensation just feels different. Or they're having intercourse with their spouse and they notice the sensation isn't there, or it's just different. That may be saddle anesthesia, and that may be something that really needs to be dealt with immediately. When you go to the doctor, because you think that you may be experiencing symptoms of cauda equina, oftentimes the doctor will offer, especially in the emergency department, they will offer to do what's called a digital rectal examination. And I know it's an uncomfortable subject, because nobody wants to think about having to have that occur, but it's a very, very important examination where the doctor inserts a gloved finger into the rectum and checks rectal tone. Because again, that is a test that will help them determine whether or not that part of the body is being affected, whether there is any motor or sensory issue in that very sensitive part of the body, and it gives them a wealth of information as to whether or not there may or may not be cauda equina. Because if they do this examination, if they see that there's saddle anesthesia, or there's deficit, some kind of loss in the perianal area, if there's urinary retention, any of those things, then that may be a red flag that the doctor needs to get in and get a neurosurgical consult and get the nerve decompressed. Now, bowel and bladder. People often talk about, well, is there bladder urinary incontinence? Is there bowel incontinence? And a lot of times healthcare providers will ask that question, have you had any urinary incontinence? And the person will say, well, boy, no, because they haven't wet themselves. And the problem is, when you're talking about Cauda equina, a lot of times what will happen is there will be a loss of sensation in the bladder as an early sign. And so what will happen is, rather than having a loss of urine, there will be a urinary retention because people are holding their urination longer. And so one of the things that you want to look for is, are you finding that you're going to the bathroom very frequently and that you have an urgency to go to the bathroom, or that you're maybe dribbling a little bit of urine but not having a flow of urine? Because what happens with Cauda equina very often, and what can sometimes fool people into thinking, well, no, this isn't that, is that the bladder gets very full, and because of the loss of sensation within the bladder, it doesn't fully empty. And so the person with this problem will end up running to the bathroom with urgency because they get too full, they don't feel that their bladder is getting full, and they urinate just a little, and then they're back to the bathroom again in just a short while. And so they don't think of it as incontinence, but that's really what's happening. And the same happens with bowel, either frequent loose stools or the failure to go, meaning they just aren't going to the bathroom, and they think, well, maybe they're constipated. And what really may be happening is there may be a loss of nerve function to the part of the bowel that is controlled by this area of the spine that may be causing the loss of nerve sensation to that area of the bowel, that may be causing the person to experience a lack of sensation and a lack of a feeling of need to go to the bathroom. So these are all symptoms you want to look out for. If you ever have any symptoms that you think might be Cauda equina, go to the doctor immediately, get checked out immediately. Don't be embarrassed or ashamed to let them do a full examination. And in fact, you should encourage them to make sure they do a full examination. Make sure they check your motor, make sure they check your sensory, and make sure they ask all the right questions that you can think of that you're hearing about. And make sure that if they don't ask the questions, that you ask the questions and you make sure you get them on the right track. Thank you.